For seeing me for the first time, fate has brought us together. Like, share, subscribe, and follow for more. Comment female or male. The contrast between addiction in young females and males lies in their causes, expressions, coping mechanisms, and recovery patterns. While addiction affects both genders, biological, psychological, and social differences shape how it develops and manifests. Below is a detailed comparison. 1. Reasons for addiction, young males. Often use substances for thrill-seeking, peer pressure, or status. Addiction may start as part of risk-taking behavior or to appear strong or cool. Social influences and curiosity play major roles. Young females more likely to turn to substances due to emotional pain, trauma, or relationship stress. May use drugs or alcohol as a coping mechanism for anxiety, depression, or abuse. Emotional and relational factors are usually deeper motivators. 2. Psychological trigger males. Linked to anger, stress, and social expectations of masculinity, may struggle with expressing emotions using substances to mask feelings. Females linked to low self-esteem, body image issues, emotional neglect, or romantic relationship problems. Addiction often coexists with anxiety, eating disorders, or trauma. 3. Type of substance and behavior males. More likely to use alcohol, cannabis, cocaine, and performance-enhancing drugs. Engage in gambling, gaming, or pornography addictions as forms of escapism. Female more likely to misuse prescription drugs, painkillers, sedatives, antidepressants, may develop food-related or shopping addictions tied to emotional regulation. 4. Progression and dependency. Males' addiction tends to develop gradually, but often becomes chronic due to social normalization. Boys will be boys. More likely to engage in binge use and high-risk behaviors. Females' addiction develops more rapidly, telescoping effect. They reach dependence faster even with smaller amounts, more severe withdrawal and health consequences in shorter time frames. 5. Social stigma and help-seeking males face stigma around admitting weakness or asking for help, often enter treatment only after legal or family pressure. Females face moral judgment and shame due to gender expectations. Good women don't use drugs. Fear of losing children, reputation, or relationships can delay treatment. 6. Family and relationship impact. Males' addiction often leads to aggression, financial irresponsibility, or isolation. Family may respond with confrontation or distancing. Females' addiction can result in emotional withdrawal, neglect, or vulnerability to abuse. Often stay in toxic or codependent relationships linked to substance use. 7. Recovery and treatment response. Males respond well to structured, goal-oriented, and group-based therapies. Prefer practical approaches focused on control and behavior change. Females benefit from trauma-informed emotional healing and supportive environments. Recovery thrives when trust, empathy, and empowerment are central. 8. Social and environmental factors. Males' peer influence, media portrayal of masculinity, and easy access to substances encourage risky use. Females influenced by abuse history, gender inequality, and social pressure to maintain perfection. Economic dependence or domestic violence often complicate recovery. 9. Relapse patterns. Males relapse often linked to stress, boredom, or peer influence. Females relapse commonly tied to emotional distress, relationship issues, or trauma reminders. 10. Path to healing. Males need encouragement to open up emotionally and redefine masculinity beyond toughness. Females need safe spaces to rebuild self-worth and address trauma without judgment. Summary table aspect: young males, young females, primary motivation, thrill, peer pressure, status, emotional pain, trauma, relationship stress, common substances, alcohol, cannabis, stimulants, prescription drugs, sedatives, addiction, progression, slower, normalized socially, faster, more intense. Help seeking, less likely, delayed, fearful of stigma and shame. recovery, focus, behavioral and peer-based, emotional and trauma-focused relapse, triggers, stress, peers, boredom, emotional distress, relationships. If you are seeing me for the first time, fate has brought us together. Like, share, subscribe, and follow for more.